Welcome to this The Erect Posture presentation. The Erect Posture is an exercise system where sitting erect is the first exercise taught. Sitting erect is the exercise needed to eliminate the pain caused by poor posture. Thank you for joining this exercise class. That's to the person who's here. To the person who sent you here, I give a very special thank you. And I invite you to become one of those people that gets my special thank yous. This is a seated exercise system, so get your chair. Sit on a chair. Make it one you can sit on for a little while. Don't make it too soft. Follow the 7-step correction instructions to the end, paying attention to how your body feels. Do as instructed and demonstrated, and accept what your body gives you while you making the softest contraction possible. Go by your body's feeling and do what feels good and avoid the pain. There is no gain in pain. That's the most important thing I want to stress. The whole demonstration of this first session is to show you that erect posture can relieve pain. So if you go to pain, we failed. So avoid pain. Please subscribe, like, ring the bell, and tell others about the erect posture. To be perfectly honest, my goal is to spread this. Okay. And you help when you tell others about it. When you subscribe. I won't ask for donations. Not that money isn't needed. Money gained in that way, it doesn't help my real goal. I need money, I'll admit that. But I'll get that if you subscribe, if you spread the word, if there are more visitors, if you go to more than one video, if you check out what I'm really saying and truly check it out. There'll be money, there's money in that. But my real goal, I'm Dr. Gwen, okay? My doctorate is in orthodontics. And my real goal is to make a difference. To make a difference. I'll get started. This is the Erect Postures Exercise Instructional Video Presentation number 1. This is the contribution from yoga. So this is yoga. But the level of yoga is, these are the chakras, and they are the instructions from yoga that I got, that I started with. I started with it because I heard that the chakra system had in it instructions for whatever the person who investigated wanted to know. And since I was straightening teeth and seeing that body types people's posture was worse than their crooked teeth, I decided I wanted to learn to do that and present it. I also had a selfish reason. As a dental student, I was told that female dentists didn't have long careers, and the reason they didn't is because dentistry distorted posture, brought pain, and therefore I would more than likely have to change my career because of pain. And so I've always tried to avoid postural pain. Make your life gold, holding your spine plumb with gravity. Okay. If you are not reclining, your bony spine has the job of interfacing with gravity. What makes your posture ideal or poor is whether your posture aligns your spine plumb with gravity and passes the test of time pain-free. I talk to people chosen by their posture being more erect than their age group. I have found that some assume erect posture to avoid pain without knowing or striving for erect posture. If you live with neck, shoulder, back pain, see if assuming erect posture brings you pain relief by following along. To erect the spine, you have the job of stacking the vertebra plumb with gravity. The erect posture is taught in 7 levels, starting at your contact point with the seat of your chair to the crown of your head. The erect posture is orthodontics, but better. It's like orthodontics, but better, because correct alignment is attained without individual treatment plans. Everyone needs to contract the same 6 muscles to correct their spine alignment, to correct the alignment of the spine. Let's get started, starting by teaching you what to look for erect posture. This is the look. That's it standing, that's it sitting. 3 spinal curves, right, of about equal dynamic form, right. So, and your sitting posture from seat to crown is the same as your standing posture from seat to crown. Okay? I need you to learn it because I did get this information on how to erect your spine. I got it from Kendall and Boynton. It's a book. I gave you the name Posture and Pain, but it can't be obtained, right? I don't know where it is legally written down. And what I mean by that, copyright infringement. That was a time when you could find it in ads on the web, but with copyrights, that everybody's had to back up off this. The way I got this there is those are their words. Those are the way the line of gravity should pass through the body. I used a mannequin, a computer program with a human body in it that I could see the spine, and I stacked it. You don't have to feel cheated because you can't find, I used it in that way, but I couldn't use it on my body. And the reason I couldn't use it on your body, I can't tell you today, with all these years looking, I can't tell you exactly where on my side would I stop if I was putting my finger level with my lumbar spine. And yet you're supposed to put the line of gravity is supposed to pass through the bodies of the lumbar vertebra and the cervical vertebra. But I don't know where they are. So I say it's the look you want. You want your head. What I see is you want your head to be behind your body. You want a neck. When your head is not, you lose it. See, when you lose your head, when your head goes this way, you lose your neck. When I'm looking at you in the front, I see your chin and on your chest. I see your chin, and when you're erect, I see a neck, a clearly defined neck. And this is an 82-year-old neck, so don't expect beautiful lines, but that's a neck. A clearly defined neck. You want a wide chest, express chest. You want a curve. You want this. You want the thoracic to be curved. You want the lumbar to be curved. You want 3. You see, you want that look, right? And the head held high. Okay, you want that look, right? And you'll start looking for it. This is how I train myself. I want you to start looking for that. If you want to see it in the best form, not seated, but to see it clearest, look at a 5-year-old. And in fact, I tell you to take out your 5-year-old picture. Go and find your child's 5-year-old picture or any collection of young people, 3 to 5, 2.5 to 5. Find them standing, right? And then you'll start seeing the upper body held erect. You'll see erect standing because they just got it. Okay? So I'm not getting you to do something new. I'm getting you to regain what you had. Okay? Okay. So that's the goal, and now we start learning how to sit. And like I said, there are 7 steps. The erect posture, I don't know if I've told you this. The erect posture comes in 7 steps, but you only have to remember 6 muscles. So after you learn how to find the 6 muscles and the 7 steps, you've learned how to correct your posture. So let's get started. The first level, the levels were in that stack of chakras. The first one is depicted as a square. That square is represented by your 2 ischial tuberosities and 2 feet. That's your base. You've got to get them so that they position the body ready to get erect. Now, I'm going to tell you, because of this angle, and this angle is appreciated by some, don't believe it, I'm the new one, but not appreciated by most people, especially if they're selling you a chair. If they're selling you a chair, like an office chair, office stool, they'll tell you to slide all the way back and then rest on the lumbar support, because they recognize if you slide all the way back, you're going to lose your lumbar curve, and now they're going to put a vibrating lumbar support in there. But that doesn't give your body what it needs. That's the best they know, I guess. What you need to know is you have to respect the 120-degree angle that your spine makes and your pelvis makes to the thigh. So the femur to pelvic bone, they don't get to 90 degrees. You can look like you're sitting at 90 degrees, but you will flatten your lumbar lordosis, and then you'll just be looking at the upright body here, but you won't have your lordosis. In other words, you will have cried and then you straighten up. You will have rounded your lower back and then you straighten up. What you need to do to align the spine is you must have that lumbar lordosis. This is of importance. You must have this base at the right angle. So, to get your base, you sit to the edge of your chair. So all that is to tell you to sit to your edge of your chair, right? So that you're firmly on that chair. You're not about to slip off. Your feet are the balance. In other words, your weight is caught between your feet on the floor and your ischial tuberosities on the chair. So you sit securely on the chair, but your feet are taking part of the weight. Now, what you want to do is you want to end up with that 130 or 120 happening here, because the thigh went downhill. I want that thigh lower than the seat of the chair. Where the top of my knee, I want it below where my buttocks hits that chair. I want it, and I may even want it even lower than that. I want it low. I want to see that big slant that I just showed you. There's that big slant, so that I can get a lumbar lordosis. This doesn't give me a lumbar lordosis, but you can't get it unless you cannot get your lumbar lordosis unless your thigh is going downhill. So that's the rule. I will show you ways of doing that. The way that I recommend in a low chair, I'm in a high chair. And what I mean by this, I chose this chair so that when I'm standing, when I'm sitting, the seat is lifted so that the seat of the chair is above my knee. I adjusted that chair to that height. I adjusted the seat so that when I was standing, when you look at my knee, the seat of the chair was way up into my thigh. Okay, so that my thigh can go downhill easily. Now, that is, if you're going to work with a chair, you might want to choose those after you learn how to sit up straight. But here's the most comfortable way I find to do it. I find when I'm in the lower chair, I extend my feet and just let my feet catch the weight out there, and my seat rest on the chair, on the edge of the chair. And just by extending my legs, let that leg go downhill. Let the legs go downhill by extending the feet. Another way of doing it, but this one used to be comfortable, but it isn't comfortable now with 2 knee replacements. It is to cross your ankle and let your knees drop out. That's basically one of the yogic ways to do it, is to, and that's the way I've always seen the person who has a chakra drawn in. He's always in cross-leg position. And this can be comfortable, but right now, my knee replacements, no. The one I told you about is the best for me. These are other yoga ones, but I couldn't do that in my 30s. Watch out for what hurts. In other words, I could do this if I was in a crowd of people and everybody was doing this. I could join them. But I couldn't tell you that I was pain-free. I couldn't tell you that. My ankles would hurt. My knees would hurt. you know. So, you know, don't go for pain for a look. But if this is comfortable to you, then you do that, you know. But this angle is sort of set. This one can be raised by putting another pillow in there, and this one can be raised, I guess, by putting a pillow on that. I'm telling you how to do it in a chair. In a chair, just extend your legs. Just extend your legs so that your legs straighten out and you get your angle going downhill. The other way is cross your ankles and let your knees drop out. Now, I can tell you, when I was young, that was comfortable. That was comfortable. I couldn't say that would have hurt, but now it does. Okay. That's level one, and you must do this, or nothing else is going to work. This is the erect posture works on. You got to do first step, second step, third. You got to do your steps. So the first one is just get so that your thighs go downhill. Okay? Now, the next one is the bowl. And I didn't understand how to turn that stack of geometry. I couldn't even choose the geometry because chakras come with so much in it. So I didn't know what, I figured instructions for how to sit up straight were in there, but I couldn't find it until I saw a drawing of the chakra system where instead of a crescent at this area, there was a bowl. And that was my Rosetta Stone. I knew at that point that was the pelvis because it was sitting in the pelvic area, and now it was a bowl. And I know pelvis, I knew from anatomy, pelvis means chalice, a bowl. So I knew that represented the bowl. I also, by observation, knew that the pelvis, in some people were wrong, where they lift their tailbone up too high, which I call tooting, or where they tuck their tailbone under them too far, which I call tucking. So there are tutors and tuckers, and that bowl says you're trying to find out how to avoid tooting tucking, because you know, how do you do it? I'd seen it done wrong enough times where people just walk in and say everybody tuck their tail. You know, tuck your pelvis as instruction. Well, that worked for me. Yeah, I'll admit it. That worked for me, but I was looking at people in the room who did not need to tuck their tail. So a uniform on that level. This one is uniform for everybody, but it's because it allows for adjustment. So now we, like a child, learning to carry a bowl full of milk. We're learning how to balance our pelvis. Decide whether we're going to tuck or toot. Find out what's the difference. Okay. To do that, you're sitting on your chair. We've already found out. Your knees are going down here. We're sitting on the chair, right? And now, rock forward on the ischial tuberosity. If you remember, the four corners of the base were two ischial tuberosities, which are rockers, and 2 feet. Okay, that rocker here is the bottom of the bowl here. Okay, so sitting with your feet in the right position, your knees going down, hold your upper body straight, and rock on your ischial tuberosities. You may have to adjust yourself on your seat again, but rock, hold your upper body straight, and know that this base of the pelvis is a bowl, is a rocker, and now rock. And while you're rocking, here's what you're trying to find out. In order to balance your bowl, you need to find out where is level. You're trying to level that bowl. When you lean back too far, when you roll back on your tailbone, when you tuck your tail your pelvis too much, when you tuck it under you, your ribs come to your pubis, and so you trap your gut in between the ribs and the pubic bone. And at the same time, the back lumbar curve flattens. Then when you roll too far forward, you dump your gut, right? And your curve in here, you feel it pinching and getting too great. And what you want to do is rock between the two until you feel you're neither dumping, nor collapsing. There is a point between those two on your ischial tuberosity as you roll on it, where you go too far forward and you know you're dumping. You go back just a little bit and you start feeling the ribs come together. And now you want to find that point where you need to feel dump, not ribs coming down. And that is a level bone, and it's experiential. So go inside and do your rocking and stay with your core. The thing that's being balanced inside your pelvic bowl is your peritoneal sac. It's a closed sac that includes the large structures, the stomach, the liver, the intestines, large and small. The kidneys are behind, the great vessels are behind. There are smaller organs that sit on top of these organs, the major organs. But the ones like the gallbladder and things like that, but the one we're thinking about are the large ones. And now all you want to do is stop when you don't feel dump or collapse. You don't feel slumping, not dumping. Go where your bowl is level. Now, and stop there, and you can play with it to see it if it's there, but there is a point there. Now here's some feedback you may need later, or that will come to you later. That point where your ischial tuberosity contacts that chair turns out to be a stable point. That is your level bowl. So right now, when you get through, just look at what's hitting the chair. And that's the reason I like a firmer chair than a softer chair, so I get that feedback from where my contact is with the chair. Roll until you find the point where you don't dump, and then mark the spot on your ischial tuberosity. Just mentally, this one time, it won't last. You'll have to find it again, but in time, you'll know that point, right? And so when it's time to sit up straight, you just put that point on the chair. So put the point on the chair now. Rock until you find it. Give me feedback in the comments on how that works for you. But it should be, it's a point. It's a point that's attainable. Now, once you've got it, you're going to forget it. This takes too long. So you're going to forget it. We'll come back to it. You know how to get to it now. Okay? The next one is, so there's the gut dumped. There's the curve. There's the gut pinched. The curve flattened. And that occurs in standing, like I say. I already knew it was there because I had noticed in postural types that exists. Postural types, these postural types that I'm noting are from Kendall and Boynton, Posture and Pain. But that's copyrighted material. And this, if you can run over that and pick that up, you can put that on the web and you'll find their version of this, the original one. This is mine, and I told you how I got it from my program. But these are their postural type. The only one I've added is the one I call the leaner, and they actually mentioned the leaner, but it's just not in the same pages that these are. But the leaner is there in Kendall Posture and Pain, and so I put it in mine. But Dr. Carol Fontaine must have gotten permission from them, because their original drawings are in a work of hers at ResearchGate. So you want to check that out. The next level. So we've got the bowl level now. So we've gone through 2 steps. We got our thighs going downhill, and we're sitting on the edge of the chair, and if you have to adjust it, right? And then the next one is we leveled our bowl and learn the point, and we're beginning to learn the point that you just put on the seat when you start to memorize the balanced bowl. Now the next one, I told you at some point that there are 6 muscles I'm going to teach you on. They stack the vertebrae. And so that's what level 3 starts. Level 3 is called the fire chakra, power chakra. It adjusts the lumbar spine. When I started getting with muscles, that was a breakthrough for me. I knew that those chakras were said more than I knew, But then I started finding out that they represent muscles because I knew, or I had known all along, that the way to get in contact with the muscles that adjust the spine, which are the deep intrinsic spinal muscles, they are here. Those muscles that adjust the spine are activated when they are the one who stack the spine. In other words, the spine needs stacking. That's what erect posture is. You need to stack the spine. And the muscles that stack the spine really are the deep intrinsic muscles of the spine. These are muscles that attach from the spinous processes, the processes, spinous and transverse, and then down into the lamella of the vertebra, down in the valley. So those muscles have to be made alive. If you want to stack the spine, you need those muscles this is the lumbar spine. This is from the Visible Human Project. The National Library of Medicine holds the patent, the copyright. You have rights to use it, but you have to credit them. So this is, anytime you see this in my work, cross sections of the human body, you know they came from the National Library of Medicine. And that it's their copyright. But you have access to it because it's paid for by the federal government. Okay, so when we're trying to get the spine corrected, we're trying to rotate the spinal joints and stack them to get them so that they line up erectly, correctly. And the muscles that will do that are right here. These. For the spinal joints to be out of place, they're rotated in wrong angles. When you saw all those types, all you were looking at was the rotation of the spine at the level was not right. And what our job is, like we say, is to stack that spine. Stack those joints. They're individual vertebrae, and we got to stack them. And the muscles that stack them are here. But these muscles cannot be talked to. You cannot say stack that. So in other words, we got to deal with what we can say to the brain and what it will do. Okay. And so I can tell the brain, lift my fingers and drop my fingers. It's got it. But I cannot tell it to put a curve here, let that round, and put a curve there. You can't say it. Say it all day long. That's the reason no one's told you how to do it. It's because you don't talk to those muscles that erect the spine directly. What you've got to find is a muscle, and this is the first of them. These muscles I'm about to present to you, the way they are unique is they cannot do the job I will give them to do, you will tell them to do, unless the spine gets tight. In other words, they need the deep intrinsic muscles of the spine to erect the spine, to make the spine contract in its area, for this muscle to do its job. That's how we're going to talk to the muscles that stack the spine. We're going to find the muscle. The 6 muscles are all 6 have in common. If you do the move that I will describe, it will activate a muscle. It will require a movement. Okay? It will require a movement for that muscle to do the job I described. And once you get that job done, the only way for that to happen is that that muscle must have a strong origin on the spine. In other words, it can't do its job unless the spine becomes awake. And that's going to be the secret. Now, I'm going to give you your first one, and you'll see what I'm talking about. The first one is, first of all, you should know that the waist, the third level, is described as a triangle, and it's a little different. This is the rectus abdominis, so it says you should be relatively flat here, and then your stability is in the back. So your anchoring of the spine is here, and this should be soft. That's our goal, okay? That's our goal. This taper here represents stabilization of the spine. In other words, you got to get this area right here. You got to get where that pink is, right there. This is not mysterious. It is known. It just hasn't been used like I said, but it's been identified. When this muscle, this is the transverse abdominis or the transversalis. I most often write it as transversalis. The transversalis muscle is a circular muscle. Its fleshy part, contracting tissue, contractile tissue, is on the side, more in the back. It's about there. It's about there to about there. That's its contractile tissues, okay? And therefore, it doesn't, unlike all the other, these are the other abdominal muscles. External oblique, internal oblique, and rectus abdominis. They take origin on bone, rib to pelvis, pelvis to rib. External, rib to pelvis. Internal, pelvis to rib. And that's giving you the direction. My sister taught me that. And rectus abdominis, from here to here, okay? They have bony origins. They don't need the spine to be erect to do their thing. They don't need. But for transversalis to really catch on and get strong, he's a circular motion, muscle. He has his fleshy part here, but then he attaches to the spine. And I'm not sure which way, that way, that way. I'm not sure. I've never done the dissection. But he attaches by fascia to the spine. And he attaches by fascia to its other side, behind and around the various rectus abdominis muscles. In other words, he is the corset. He's the corset of the waist. He makes the full circle around the waist. Okay? But he's only contracting here. But for a muscle that's circular to contract, he has to have a solid base too. It's here. It's on the spine. His origin, when he's doing his job, is the spine, the lumbar spine. He's coming in where there are no bones. This area has, after here and after here, there is no bone toward the midline. Nothing but the spine. So the spine has to get strong for him to tighten up the waist. That was the setting I told you you're looking for. You're looking for an action that when I tell the brain, give it as an instruction, the brain then knows how to do things. So when I tell you to breathe out and make your waist as small as you possible, and then relax, and then breathe out again. Waist as tight as you can. Make that circle. That's the transversalis being activated. Relax. Do it again. Now what you're beginning to feel is his fleshy areas back there. Now, I teach you by breath. That's how I teach. That's how to activate. But, in fact, I want you to learn how to keep those sides tight while you learn to keep the rectus abdominis soft. So, learn to hold that. Well, learn to hold that while you breathe softly. And then forget the breathing, just learn to hold that. What you're doing there is just what's needed. You need stability to come from the rectus abdominis, because what you're feeling when you're feeling that being held is your lumbar spine contracting. So I want you to get aware of, from now on out, what area of the spine feels the direction or feels the movement I just gave you. This is the only one you can hold tight if you need to. But I need you to learn how to let this go soft. Let me know how that went. Feedback. But that's how it's done. I need you to punch that in. And if anyone has an assignment that they must do, this is one I would like to see how it worked out, but I don't know. I won't know the young man. But I had a young man who tells me every 6 months he must take an exam in a sit-up, and that he's sort of racked with pain all the time afterwards, for a while afterwards. And then 6 months later, in order to keep his job, he has to do so many sit-ups, I don't know how many. Well, my suggestion is learn how to breathe like this. And stop practicing sit-ups. Just practice this. Doing it hard. 7 times a day. Okay? And then in 6 weeks, try and see if your sit-up isn't better. Because now you will have trained the muscle that makes the back strong. When they say your core muscles are not strong, look it up. You will find out they will say, in the area, looking for the reason for back pains, they will say the transversalis and multifidus. And the multifidus is just the name of the biggest collection of these muscles in the spine that get activated, the ones that run from vertebra to vertebra. Let me show you a mannequin. This is a spine. You're looking at it from the front now, okay? So that's the body of the vertebra, and that's the site of rotation. It's in the front. So you roll that way, that would bow your body forward, okay? The muscles that we are working with and making strong are these back here. The gray rope that you see there. The gray rope is not covering the whole entire area. It's covering the middle area. There are others that run out here on the side. These muscles. They need to be activated. Okay? When all of them activate, that's what stacks your spine. So that's what we're learning how to do, is activate them. And one of the reasons I made this is so I can pull this out and show you in my hand that that's not little. If you got that on both sides of your spine, you got a muscle that's really short, really close to the site of correction. Short muscles can be the strongest contractors. So you got a flurry of short muscles right in here. They go from vertebra to vertebra, and they erect the spine. And that's where they are. So when you're doing like this and you're feeling your transversalis, notice you're feeling your spine in the same area. And that's the only way the transversalis can pull back. It has to have something to pull against. It pulls against the spine. But you can go soft and hold them. In fact, that's what I want you to learn to do. There should be flexibility here, because in normal breathing, this is soft. But there has to be stability. That's the one you need to learn how to, if you're going to hold your spine erect, if you're going to find out how to hold your pelvis, your lumbar curve right, let those muscles stack it. You don't have to choose it. You just have to learn how to tighten it. That's your job. And your body will stack it. After you've learned how to do that one, that's the lumbar. The next area is the thoracic. That's the area of the ribs. Okay, thoracic spine. The thoracic spine, when it's wrong, is that hump people hate. I get more comments on, I hate my hump, or I hate my neck. Right? I hate my hump, or I hate my neck. Another one they don't say they hate is that collapsed boobs. But they get the surgery for it. Okay? That's the collapsed chest. Right? And the other one is you pinch your waist. When you're down like this, you pinch your waist. Okay? So now we're trying to get your waistline. We've started your waistline because we've just gotten that pinch in the back that gives you this curve. See, I'm overweight. Okay, let's agree. Okay, you might be shocked at an old lady being overweight, but we tend to do that in time. But I have a nipped waist. That's what the transversalis gives you. It gives you a waist. It gives you a waist-hip ratio. Okay, so you'll get something out of it. Your weight you got to control too, but you'll get your waist if you learn level to hold the transversalis tight. Now, we got to get this chest from being collapsed. We got to lift this chest. We got to flatten that back. We got to get it ready for head held high. That's the thoracic area. The chakra for that one is two hearts. I mean, two two, it's called the heart center, but it's two triangles. It's two triangles. What are the triangles? See, it's yoga, so I had to interpret that. You see, I have the drawing. I got this on my hand. It's mine to interpret. This one, I don't know. That one I knew. That one was sort of easy, but it didn't come easy. This one didn't come easy, but this one was a real pose. But it's make the chest wide. All I am when if you're thinking of yoga and you're thinking religion and philosophy and all that, you've gone way above me. I'm hatha yoga. I'm how is it physically. Okay? How is this to be interpreted physically? You'll never get the intellectual lecture out of me. You're going to get from me how to straighten your body, because that's all I asked for. That's all I want to know. What you want to do is, it's a feeling. So that's what I knew. I was going to have to change my body in some way that it feels different. And what it turns out to be, widen and widen. You need to widen up high from here to here. To do that, you're going to, if I tell you right now, put your hands in this position. I need your hands in a position. I call it the golden position. Put your hand in this position, because what it does is it protects and it makes sure you don't think it's the shoulder. Okay? I don't need you thinking this is shoulder move. This is a move done in the rib cage. It changes the shape of the rib cage. So we used to say, open your heart. I say, make room for your heart and lungs. So put your hand in this position, and then your first description I want to tell you want to do is widen from here to here. Widen the distance from here to here with your hand in this position. Widen it, just from here to here. Make it wide. Now, the next one is the lower one. And the muscles, and it represented by muscles. When you widen this, the pec minor goes down in here, and he lifts the ribs up and out. Okay? And it ends, pec minor goes from here to here, ends. That's the coracoid process of the scapula. Okay? Then it stops there. But then for the higher motor centers, see, they know how to do things. They know for you to lift that up and out. The pectoralis minor runs into the coracoid process, and then the lower fibers of the trapezius go down, and they activate the spine, the deep intrinsic spinal muscle, from T6 or so down to T12. That's the chain that happens when you do this. When you get that out of the muscles, you widen pec minor, lifting the ribs, transfer the information back, and the lower trapezius does the rest. That's what you're working with. For the lower to spread, we're looking at serratus anterior. Serratus anterior goes behind the scapula, and on the underside of the scapula, it ends. The rhomboids then pick it up, and they take it to the spine. And so in order for you to widen here, if you just tune in, widen here, you will feel the upper neck, upper back. Take the load. Those muscles can't do that any other way than for these areas to get active. That's the description that was in the triangle, the double triangle. It was a feeling. Widen here, do them at the same time, and you feel the whole thoracic area from here to here become active. Now, you've made the lumbar active here, stack those vertebrae. Now you stacked these vertebrae by widening here, widening here. those are the muscles that can't do their job. That is the description that I want from you, that you can't give me any other way than make the muscles I want contracted. That stacks the spine. We now have the spine stacked from the lumbar transversalis to the neck, through the entire thoracic, in two sets of muscles where it takes a link of two to get it done. Widen here, you go from pec minor to here, then lower trapezius there. And you can't do it any other way, but once you tell your highest center you want to do it, it knows how to do it. They know how to do it. It's a collection of three. And it bounces that information and then sends it down to the spine. Widen, widen, there it is there. The final one that's done by muscles, the final one, and what that does is, but the shoulder wasn't positioned that way. The shoulder was just positioned. Put your hand like you're holding a mic and a ward. Let's say you want a cute little old trophy with a nice round base. You're holding your trophy and you're proud of it. You hold it like that. You're holding the mic. You're holding your bridal bouquet. Big bundle of natural flowers with big stems wrapped in ribbon and put in your hand, and you're walking like this. You're sitting like this. You're posing like this. That positions the shoulder. So I take out you thinking this is a shoulder blade thing, because if you think this is shoulder blade, you're in for pain. Okay, there we go. We know that one now. Let's go for the next one. And here's where the shoulder blades are not right. In this group, that group, and that group. But it's different pelvic groups. But the shoulders are two. When I say somebody's back is round, no, I mean it's round from top to bottom. In the thoracic area, there's roundness. And that is round side to side. This is ideal. Round, round. This is military. That's the person who thinks this is how to straighten your spine. That's the reason I got your shoulders, so that you don't do it this way. Because that's a problem. That's a painful problem. Have that one. Know that one well. And their chest is too high. I met a young lady who said her parents when she walked past, they'd hit her in the chest because she had a tendency to do this. And they said, in training her. There are families who train posture. And the final one. And the interesting, the two tuckers, pelvic tucks, both of them have a collapsed chest. But there's a tutor who has it too. Round back. I call them round back tutors. And this is a leaner right there, who's who I am. I have a tendency to be that. I gave it up for a while to get worse. Now I'm trying to become ideal. Postural types. Once you got the pelvis wrong, you got it all wrong. It's all right or it's all wrong, precious. Next thing. After you've gotten that now, so we got this tight. Let's go back. We're back on our seat, on our ischial tuberosity. We've balanced our bowl, so we're sitting on our ischial tuberosity correctly. Okay, that's balanced bowl and the feet in the right place and the knees in the right place. Then we've tightened here. Transversalis is tight. And we're trying to learn how to keep it tight at all times while letting the abdomen just be natural. Next thing, we've widened here and we've widened here. And so we're doing it, and we're not doing it hard. That's done softly. Hold it with the softest, after you find it, hold it with the softest contraction as you can. Make it as soft as you've made your stomach. But keep the transversalis and then keep the others widened, but just softly. Okay? Once you're through with that, here's what we've got. We've got a straight posture up until this point, and then it bends. Right here, and it bends. And this will be a site of pain. Okay, yeah, it can be a site of pain. And this is one I think I see. I think it's technique. That's the definition of text neck, a tech neck. This is this. Your body does not know what you call exercise. So if you're doing this all day, even if you're sitting straight, if you're doing this all day, right, and your instruction is not to counter that with this, then what you have is you can have straight and then you bend right there. And I'll be perfectly honest, I was finding myself that way. So this is what I think in fact, I have to talk to a lot, when I'm talking to people about their good posture, most of the times I have to say, but your neck is too far forward. And then I show them how to do it. And here it goes. Roll the head back. Get everything right now and just roll the head back, right up here, the neck. You're going to make this straight. You'll take this from here to there. Okay? It's a rotation. You have what I call the hackles. These 4 spikes, these 4 vertebrae are longer than all the others. And they can stand up. And you see them in people's back. Just standing just so proud and wide open. And what you want to do is collect them by taking them back. Okay? That's what you need to do. There. Now, look at this. Here's the muscle that produces it. Serratus posterior superior. That area is so wrong so often. There are 2 muscles up there, you remember? We just had the rhomboids work that area. Now, deeper in, this is even deeper than the rhomboid, it's this. And just stop there, okay? So what we've done is, if you want to look at the thing, what we've done is we've taken the head with the chin too far forward and the neck too far forward and the hyoid bone, not the hyoid, with the windpipe sticking out. The logo, the chakra is that. A circle within a circle. There's a muscular neck out here. A muscular neck. And then there's the visceral neck. And I call it the visceral neck because it's your windpipe and all those things right here. You know, they're right here. And they stick out in a lot of people. You can see them when people are thin. You can see very strong 2 divisions. You see the muscles stopping here and everything goes out here. And when that happens, the head's too far forward. The chin doesn't have a nice definition. And so people correct it. I know people don't like it because they correct it by taking the skin in this area and tucking up here. But what needed to go was this. Go back here. Put your head back. And when you let your head back, feel that you rolled it back. But the reason I say sometimes there's 6 or 7 muscles you must know, only 6 you have to contract. When you do this, it changes the balance. And when it changes the balance, it comes on with 2 muscles. The serratus posterior superior and the serratus posterior inferior balances that out because you change the balance. So you feel 2 new muscles going. Keep this one tight, keep that wide, let that go back. Now, that's the end of 5, which is sort of like a resting point. And now the final, the next move is, what it does is straighten the neck here, okay? That's what it does. It closes that down, but mainly it straightens up the neck instead of sending it out to the front. Then the next thing is the level 6. Level 6 is the eye on the horizon. And what that says is just let your head drop. You don't drop it. Just let your eyes dictate how far your head comes. Just keep your neck back where it was. In other words, you took your neck back, it was straight, hold it straight, and just let your eyes come to the horizon. Because your eyes gotta come to the horizon, baby. It's a reflex. There are a lot of reflexes in the neck. They're in the semicircular canal, and they have to do with balance, but they have to do with your eyes on the horizon too. You gotta see what's going on in front of you. So after here, just let the head rotate, but keep the neck back. And what you end up with is that long neck. And that, if that's done early in your life, that doesn't let your chin get all saggy and pulled out here. And the reason is, the reason you bag when your head is forward is that the shortest distance between 2 lines, the 2 points is a line. And so you've made a line, and therefore you had too much tissue. But when your head is like that, that's the long line. It all has to collect up and go in there. Now, unfortunately, I can't demonstrate it because I learned this in my 80s. I I've already stretched out, but I think it's getting better. So put your eyes on the horizon while keeping the head back. And now you have that neck. I always say, most people, you can cut off that neck if you wanted to, because the head is, I can't demonstrate, the head is out here, and when you look at them straight on, you know you'd drop that, you'd have to go through that jaw to cut off the head unless you stretch them out. Well, here it goes. A neck. You want a neck, you want a wide chest and a neck. And your poor postures is why you don't have it. And if you start learning to get your posture, you might get it back, or you might not get as bad as most old people are. So there you go. That's some of the beauty of the erect posture. Posture. There is a desired angle here, somewhere in 90 to 105 degrees. You get that when you lift your head. Put your eye on the horizon. Let the reflex manifest itself. So here's the slide about 105 degrees. That was research. This is someone who has good posture up until the neck, and that's what I think we're practicing with tick neck. We got good posture, the few people who have good posture, and yet they're doing this all day long. Well, if you're going to do it, after you do it, do this. Practice going back to right. I don't tell you don't do it, although I'm beginning to start saying you ought to do it like this. After you get through it, it's same. To balance. So that you end up with that pretty neckline that looks like a ballerina. It's being recognized that the head is too far forward. And this is a way, I don't want to be the person who comes out and say who's wrong and everybody, and just spot where I know people are teaching wrong and just roll over people because I know and they don't know. I don't want to be that person, but I've taught this one and it's wrong. I was taught this one and it's wrong. And why is it wrong? Okay. My sister and my husband told me it was wrong. I'd come in and I'd have my posture and then I'd be saying, and they said, something wrong with that. And the reason there was a waddle that happens, when you do it like this, you collect stuff under here, and that gets to be a waddle. And they said, that can't be right. It doesn't look right. No, go back and get that one again. And I tried very softly and said, that's not it. And then finally I realized it was this. I stopped. Here's what's wrong with that. Now, then my question is, why isn't it right? Because we're working with muscles, and muscles only contract. So you can't you can't push anything that looks like you pushed your way into the position. You did something different from what the body needs in this alignment. It has got to be a contraction behind the disc, because this is the site of rotation. The site of rotation is in the body of the vertebra. So that's the reason everything is being done right in the back. So this one, when you do it like that, there is a muscle there. It's called longus colli. And if you're doing this, what you're doing is you're telling that muscle to contract. And what he does is bow the neck the wrong way. And you'll be told to do that for the next 50 years. And you'll never get out of it. Because it's the wrong move in the wrong place. You want that neck to have the right shape. It's here. And relax. We've gone through the 6 corrections. That's the final muscle. That's the serratus posterior is the one that takes the neck and just pull it back. Use the base of the vertebra. Use the base of the ribs as its attachment, and then it just pulls the head and the neck back. And then you let it win and sit up straight. Okay? After that, the 7th one is the 1,000-petal lotus. 1,000 petals. The idea is its movement. To learn to reprogram the body, to write protein, to change the body physically. There are a couple of things for learning to happen. Luckily, some happen automatically. One is you need to forget it. Your memory has to be so. You forget it, and then you go back and correct it, and you forget it, and you go back and correct it, and you forget it, and you go back and correct it. Know that's really very healthy. The body learns from that. You forgot it. You had to go back and correct it. Therefore, the correcting is your job. Forgetting is automatic until your body learns to do it. I don't know when that happens. Mine hasn't. Okay, but now we've got to get some movement in here. And so the way we're going to envision it, you're going to stack your vertebrae. You're going to get on your ischial tuberosity, rock and find your point, get your bowl balance, activate here, activate here, activate here with your hands in this position. Roll back, come forward, and now you're sitting erect. Make it soft and breathe. If you want to do the breath hard, do it. You know, so that's like your sit-up. Your 7 breaths. But what I want you to do is I want you to be one of these pieces of sea grass. There's a little chop up on the top, but it's nothing. It's water. It's moving just a little bit. They're tiny, tiny little waves. They wouldn't make a noise if they hit the shore. They won't slap, slap, slap. They just make the shore move gently. You know, you'd see the water come in and go back and the water come in, and it'd just be nothing going on really. Smooth almost. From a distance, you'd say it's almost glass-like. So what's happening at the body? This grass has a tendency to lift. There's some upward pull of that grass. Become a piece of grass and lift up and it's almost like the molecules of the water more than the surf. There's just a little rocking play in here and your body is experiencing it. Go inside your body and become that grass and lift up and rock around and stay with your positions and do it as softly as you can. Become a soft piece of grass, just lifting up because that's what you do. And you're anchored at your sitting bone and you lift it at your crown and you're moving around in no particular direction. There's just the way you went this time has nothing to do with the way you go next time. There's no pattern. There's just movement. And become that grass and become softer and softer in being that grass. And attend to every position and see if you got it right. And be there. And breathe. Go in. Go soft. Go to your area of usual pain, if there's such a thing, and be with it and see if this is what you're looking for. Go inside, go deep inside and feel if there's a vibration or a sweet feeling inside. Just for a fact, maybe there. You're not trying to make it be there. You're just checking to see how does your body feel inside. Go right down that cord that's at this very center of you where you stacked yourself. Watch what's happening at the level of that cord that goes from the seat to the ground as you move. Do soft, almost sighing breaths. Stay attentive. Do it soft. Do such a small movement you wonder if I could see it. All of this presentation, this is all I was trying to guide you to. See if you learned it. Experience it. Do this as a practice 7 times a day. Take 7 breaths and then just stay in the movement just for a short while so that your body starts learning how to get this, how to hold this. And just breathe softly. Breathe and relax. Let's take 7 final breaths. Exhale. Inhale. Open your eyes and join the mannequin in the last 5 breaths. Okay, that's the experience of the erect posture. And that's the exercise I'm teaching you. And you wanted that to be soft. Learn how to make it softer and softer. Record your process. Record the progress. Start with beginning. Use your phone. You have phones. And that means everybody has a camera. If you have a camera, use your camera. Take pictures of you in side view. Take pictures of you in side view. The way you sit, way you stand, so you know your postural type. Take pictures of yourself when you're doing your practicing at the start. See if you get better at it. Record your progress. Another recording of progress is breathing like I just taught you will change your waist-hip ratio. It is to make your core strong. Marker of a strong core is marker of a strong transversalis. And the literature say, Google it, you'll see multifidus and transversalis are strong cores. Less backache if they're strong, but you see why. When the multifidus is developed, the transversalis is developed. Because the multifidus strength is gained through the multifidus being strong, doing his job. So the two are linked. So record that as your waist gets smaller, you will find your waist-hip ratio will drop, right? So work with that one 7 times a day. All of done at the same time. The next thing is if there's an imbalance. Let's say you have a scoliosis with a high side and low side. Because contraction is the only way to use exercise, the only way you can contract, level out an uneven, imbalanced spine is to contract on the elongated side. In other words, there's a balance here. For some reason you're here. You cannot contract on this side and do any good. It will worsen it. Only that one. There's no need of doing balance. I lift, I balance it, I do some of this and I do some of that. That's just saying I don't know what to do. The answer is the elongated side needs the work. Okay. And then the next thing is record on one of these sets of pictures, print it and draw your pains. Your pains will make sense. See, this is like this is true physical education. This is, when I get through with this, just like you're learning how to do this, you will understand your body and how it works mechanically. And your pains will make sense in time. Write them down. You'll understand them. If you stay with me, you'll go away from it and you'll understand how you're moving away from it, and you will understand. You will correct it and understand it in time. Right? If it's going to correct, you felt it today. That's my point. And if you felt the correction, pass it along. Thank you for coming. Thank you for joining the exercise class. Please come again. Tell others about it. Tell anybody you tell them I said thank you. Come, please come. And thank you to the person who referred you. If you followed my instructions to a pleasant sensation, you've learned all I've taught. That's all I'm teaching. At this early stage, you won't see correction, the corrections you want. But these are the early steps. If these early steps are right for you, they gave you some relief. So give me feedback on that. Please help me to help others by subscribing, liking, ringing the bell, telling others, and seeing other of my videos. If you subscribe and if you're liking, here's why I tell you to like also. That I think that liking is the one that gets you, ringing the bell, I don't know which one. One of those gets my computer to tell your computer when I put out something new, because I'm 82. These are not easy to put out. So I'm going to be a little slow. But I'm doing them as fast as I know how. But I'm learning how very hard they are to do. Okay, thank you for coming. Please come again. Give me feedback.